I'm hanging in there. I can't complain.
Good.
So, tell us a little bit about yourself.
Sure. I am a licensed psychologist. I've been in private practice almost 8 years. Just recently published the book, The Practical Guide to Raising Emotionally Healthy Children. That's been pretty exciting. And then I'm speaking just throughout the country on school violence and bullying and how to raise emotionally healthy children.
Right. I was looking at that on your website. So, what caused you to write that book?
I really wanted to write it as a preventative measure for families because what I have found is that there's so many mental health problems and conditions that we actually can prevent if you use the tools that are in the book, and really and truly it's making sure that children know how to respond to situations that happen to them.
Yes.
Because when you respond with extreme fear or anger, which kids are doing, they're lashing out or they're depressed or they're anxious, and it's causing other problems, but there's a lot that we can prevent.
Yes.
So,
I'm into that. So tell us a little bit about your outstanding achievements, because I was stalking your page the other day, and you've done a lot of awesome work. So just tell us a little bit about your career and what you've done and what caused you to get into the field of psychology.
Sure. So I absolutely adore and love the field itself, and particularly children and families, which is my specialty. So that really helps me get into this field, just because I really wanted to make a difference for that population. Currently, I'm the president-elect of the Florida Psychological Association, the first African-American to do so in the history of the organization. So that's pretty exciting, just making history. And in that role, really, in the Florida Psychological Association, I've also gone to our capital, Washington, D.C., and our state capital, Florida, Tallahassee, and just advocated for mental health patients and mental health professionals with legislators. So that's been definitely really exciting, as well as, in my spare time, as well as I'm also on the board of the Ryan Neese Foundation, which is an incredible foundation. I absolutely love being a board member. And that foundation, more or less, we have what's called a student service program, and we're helping teens to learn ways to be leaders and to help others and to give back. And it's been an incredible experience with that group as well. This past year, we went to Flint, Michigan, and Detroit and helped those communities, obviously with the Flint water crisis. And then last year, I went with them to the Dominican Republic, and we helped some communities in need as well.
Oh,
so
wow.
I like to do a lot of outreach.
Wow, that's awesome. And we need more leaders like that in the community who take more time with the youth, because I think that mental illness is something that is a serious issue within the community as a result of traumas that we've suffered from, mainly in our youth. So when we have psychologists who step up and deal with our youth, mentoring them, that kind of combats the issues they will suffer later on down the road. Which brings me to my next question. What are some of the emotional hang-ups you've seen with the more economically disenfranchised communities as it pertains to mental health?
So what I've seen, and what the research is actually showing too, which is very scary, is that especially with children and their brain development, when you are economically deprived, you experience more stressors, generally, than the average population, and the way you respond to emotions really starts to change, because at a young age, if you're exposed to poverty or you're exposed to violence in your school and violence at home and violence in your community, your brain, when it's developing, you're always on guard. And then what's happening with these children is they start to become aggressive, obviously, because you feel like you're always on guard. So even if someone's like, hey, how are you doing? They could be triggered, and it's like, well, what's wrong with them? Well, that they're responding in the way that their brain is, functioning, if you will. So it can have a very detrimental impact. But the positive thing, like you were saying, and that's why I love working with the youth, is that if we do things, if we connect with these youth, if there's a mentor in their life or their family member or someone around them, it can just make a world of difference. That's basically a positive influence for them. It can change their lives.
Right. Man, I agree with that completely. Psychological side effects of medication prescribed to those being treated for mental illness. I know this may be a touchy subject, but what is your stance on that?
So So it is, of course, it's a touchy subject and it's controversial, but I'm pretty strong in my stance. I mean, my stance when it comes to medication, and I've told many families this, is that I am not against medication. However, I do not think in many cases that should be the first resort, because in my almost a decade in practice, I have seen so many children and families that have benefited from only therapy. Mind you, it could be milder cases or mild to moderate cases, maybe not the severe cases, and they have thrived and flourished and learned the strategies to turn their lives around. Or if it's ADHD or depression or anxiety or whatever it is, they learn how to deal with those symptoms, and they don't have to take medication. But again, like I said, there are some very severe cases of certain mental health conditions which do, necessitate medication. So I'm not completely against it, but just not the first step.
Gotcha.
You don't have to. Why should you?
Yeah, I agree with that completely, because I've seen like some children who are prescribed medication for ADHD or various other mental deficiencies where they kind of are lethargic or they're unable to be coherent and function normally. So
yeah, and I've seen that too. And I've always said I'm not a psychiatrist, I'm not a pediatrician, I'm not a medical doctor, but I've always referred those families back to their medical doctor. I'm saying, if your child, they're saying, oh, my child's drugged up, or they're so drowsy, they can't, now they're falling asleep in class, and it's like, well, that's probably not the right dosage. You need to go back to your medical doctor and talk to them about that, because they shouldn't be like a zombie.
Right.
That's not really the point of any medication, and that's horrible.
Exactly.
So, yeah, there needs to be some adjustment.
Okay, so getting into the topic of abuse, I know we recently had the Domestic Violence Awareness Month. How is it linked, shall I say, to issues pertaining to mental illness, especially within the African American community? I've actually witnessed that be an issue where those who go untreated become abusive, aggressive, and violent.
Right. And it's very similar to before, especially with the brain studies that are out now with physical abuse and, in some cases, even emotional abuse as well. Those types of abusive situations, you are teaching, when we think of a young baby, for example, and the baby cries, and most caregivers would respond to the baby, see if they're wet or if they need a bottle or whatever they need. But when you're in an abusive situation or a neglectful situation, none of your needs are being met emotionally for that child. So you learn already, do not trust the world, because if you can't trust your caregiver at home, you're definitely not going to be trusting your teacher or your peers or anyone else. Right. So it totally warps your sense of safety, which is what you need. Yeah. And so what's happening is some of these children, 10 years old, 8 years old, we hear them, they're going to school with guns. They're, they're afraid to go to school. All these negative things because they're afraid. That is what they have learned. You mentioned on your page that you do a lot of counseling for children who their parents are currently deployed in the military. I'm prior military, U.S. Navy for 10 years. Well, from the start of the practice, I jumped on TRICARE, which is, well, as you know, but it's the insurance for military families, and I absolutely love that population as well. I really consider it a subspecialty. So many of my families I've counseled or done psychological evaluations from over the years have been military families. So it's been an honor actually to work with that population. Okay, so I'm going to get real briefly into the issue of mental illness in the correctional facilities. What is some of your experience with dealing with that, if you've had to deal with it? So I have not been in the actual jails or prisons myself, but I have heard many scary stories from individuals that I have done evaluations on about, quote unquote, the system, and it's pretty scary. So again, I don't want to speak firsthand because I wasn't there, but from what I've heard in the stories, I've heard that in many correctional facilities that there's a lot of over-medication, and people have basically felt like they've kind of been given a lot of medication just to shut them up so we don't have to deal with them. Yeah. I've heard from many young adults, particularly male, that they felt like when they went in and when they came out, they actually developed mental health conditions like paranoia and hallucinations and those types of things because of the environment that they were in. So I've heard a lot of trends and patterns that, well, many people have told me over the years, which is very scary.
Yeah. Yes, I was actually doing some research on that earlier, and just a quick, little brief write-up that I did for it. It was stating that in the United States, it has the highest rate of adult incarceration among developing countries, with 2.2 million currently in jails and prisons. Many of them are with mental disorders. And they are becoming more increasingly incarcerated because they're not in the right mind to represent themselves or get the correct representation. And it's kind of become the de facto state hospitals, so to speak.
Absolutely. Yes. We were just, anyhow, I'm on some listservs with other psychologists, and we were actually having the same discussion that it is so scary because what has happened is way in the past, we used to have way more state hospitals and institutions and those sort of the inpatient facilities for mental health. But unfortunately, due to the abusive practices that were happening in those institutions, that got shut down. Now we're at the other extreme where basically, like you said, it's either homelessness or jail and prison.
Yes.
And that's how we're treating people with mental health, which is absolutely absurd and inappropriate, but that's where we're at. Yeah. And it's horrible.
Man. So with our brothers, for example, and I do notice that a lot of our brothers suffer from mental illness, and it goes untreated mostly with our brothers. How do we get our men to acknowledge when there is possibly an issue where they need a diagnosis to get the proper treatment? What is your advice for that?
I think as a mental health community and the community at large, we need to do a better job of education.
Yes.
Because what I've heard is that, well, I don't have a problem, or I don't want to admit it because I'm not crazy,
right,
or whatever it is. It's like, oh, they're just like their dad, or they're just like their mom. It's just a bad kid. Those are the type of things I hear, and I'm like, actually, they're probably suffering from fill in the blank, depression, anxiety, something, post-traumatic stress disorder, and all these other things. But what's happening is, first of all, some people either don't know what they're experiencing to begin with. They don't have a label for it. They don't have the terminology to be like, okay, this is actually depression. No, you're not just sad. You are clinically depressed. Or if they do recognize, I think there might be an issue, there's such a huge stigma, particularly in the African American community, of getting help.
Yes.
Because you're supposed to keep it a secret. You keep it in the family. You don't talk to strangers about it. But it's sad, though, because there's so much suffering that's unnecessary.
Yes.
That's happening.
Yes. Especially when you take it from a spiritual perspective, and we're under the misconception that you could just pray it away.
Oh, how many times have I heard that? I've had so many pastors that have called my office saying, Dr. Hammond, I need your help because this is above what I can do. And yes, I'm a Christian too. I go to church and pray and all those great things, but God also put people with mental health professionals out there to get you help.
Yes.
So, I mean, it's one thing, and even pastoral counseling or counseling in the church, it could be, minor issues or something going on in a marriage or something brief and small, but when it really gets to the clinical level and people are talking about wanting to hurt themselves or hurt someone else, or it's just to a level that it's beyond what the church can handle.
Yes.
And like I said, I've had the calls from churches saying, I can't do this. And unfortunately for some churches, they're saying it's actually a burden on them because they feel overwhelmed because, like, they're saying we don't have a clinical psychologist here to handle this. But again, it goes back to that education piece where we're not saying, I have never said to anyone, nor does the mental health field say, give up your God and just come to counseling. No, we say, keep your spirituality, and there's some Christian counselors out there.
Yeah.
But keep your spirituality, keep your religious beliefs, whatever that may be, but get the help that you need for your mental health condition. You can do both.
Amen to that. I agree with you on that one.
I'm not preaching.
No, nothing wrong with that. So new research suggests that experiencing intense psychological trauma has a genetic impact on a person's future as well as their children, which could also be an explanation for the issues that we see with many of the youth today, as well as what we call in our community generational curses. So it's called, I think it's genetic effects, or it's pretty much a mutation of the strands in your DNA, where there's a chemical switch that causes you to pretty much kind of struggle with anxiety and stress disorders and various other mental illnesses as a result. Have you done any research into that, or what are your thoughts on it?
I think it really, I've heard briefly, like so with some of the brain studies, and it is really scary because there is evidence that, like you said, with those traumatic experiences, that you can change the brain and you can more or less change your neurochemicals and things like that, which if that person, obviously were to have offspring, then it's possibly going to affect their child as well. So it's really difficult because now you're battling the physical aspect, but the good news is that even with, it's the same thing medically, the same thing with mental health, even if you have the genes for something, the stress level is something that you can control. We can't control, well, not yet anyway, we can't control our genes, but we can control our stress level. So the same thing with sometimes with diabetes and high blood pressure. I mean, the doctors always say control your stress level, do this and that, change your diet. It's the same thing for mental health. So if we can teach youth how to manage their emotions early, then they don't have to get to that extreme level of stress where they're breaking down, they're destroyed, they're torn apart,
right.
And then the genetic aspect and the stress, now you're really looking at a mental health condition.
Yes. And I'm pretty sure you've seen that quite often in your field of study as well. Yeah, and I've noticed that because I do some youth mentorship with some of the local kids in the community, where I've watched many of them, their parents struggle with various aspects of mental illness or abuse, and in turn their children grow up and have some of the same characteristics as the parents, especially when you're dealing with those of older generations who they were first generation freed slaves, and so to speak, just kind of passing on down. Actually, the term for it is epigenetic change, and that was the term I was looking for, so my apologies, I had to correct myself on that.
I definitely have seen that, and one of the scariest things, which is why it keeps happening generationally, is because in that particular home, it becomes the norm.
Yes.
And sometimes abuse, when you're a child, whatever your household says is the norm, that is the norm to you. It shouldn't be the norm, but if it's abused and you're getting hit with a belt every day and you have bruises all over you, but that's the norm and that's how it should be, that is what you learn as a norm. And when your mom or your dad does it, and then your grandma and your grandpa does it, and everybody's doing that in your family, that is your norm. So when you have kids, that's what you know.
Yeah. And
actually, I did a story a couple years back on Adrian Peterson. I don't know if you heard about that story.
Yeah.
And then, because the news station came to my office and they asked me, is that abusive? Because he said he was raised like that. And I said, absolutely, that's abusive. You cannot beat a 4-year-old from head to toe with bruises all over him. He had bruises on his genitals. That's not okay. But his excuse was, well, that's how I was raised. And that's a lot of people's excuse. But that is why it happens generationally. Because we have this notion of that's how I was raised. Yeah. It doesn't make it right. It really doesn't.
See, I wish these studies was out when we was kids, because we got our butts beat. So.
Well, now we know better, so we need to change.
Yes.
We need to start changing.
Yes.
Times are different. This is 2016.
Yes.
Whenever my parents tell me, well, back in my day, I'm like, this is 2016. We're not in the 60s and the 70s. We're in 2016.
Yes.
We know better now.
And I noticed, like, with my siblings, they all have children. I don't have any children, but I noticed that they're not as strict on their kids as our parents was. And honestly, their kids don't have half the disciplinary issues that we did, because they weren't getting beat. So.
And that's the thing. I mean, and that sometimes is an excuse too. It's, well, I turned out okay.
Yeah.
But yes, there are some people that are severely abused, and they do turn out okay. But that's still not an excuse to abuse your children.
Yes, I agree with you on that one.
Yeah.
So, real quickly, because I'm getting ready to wrap it up, I know you have a lot going on right now. What were some of the worst cases that you've seen? And you don't have to give any details. Just, for example, a story of something that you saw that just really broke your heart.
The worst, and I'll try to not give as many details, obviously confidentiality reasons, but
Exactly.
and I won't give ages and all that good stuff. But the worst story that I have seen was when I worked at a particular inpatient facility in the past, and there was this little boy, and he was so angry. The amount of abuse that he suffered physically and the amount of domestic violence that was in his home was off the charts. It was horrible. And he got to the point, he was actually hospitalized because he attempted, at a very young age, attempted to kill his mom.
Oh.
Which is scary, and I would explain how, but it'd probably be too identifying. But it was in a way that we were like, you should not know how to do this as an early elementary school student. So very scary,
Wow.
and so young, and he's so angry. And it was just really sad because not always, but a lot of times what we were seeing when we started to look into the families of children that were, there was more children there that were hiding knives under their bed and threatening to kill their parents, and those sort of extreme conditions is you look at the situation, you're like, man, they're in a household where they're experiencing a lot of physical abuse, sometimes sexual abuse, drugs are in the home, people are in and out of the home. It's just such an unstable environment, and then you see the product of that,
Right.
which is very scary, and it's just things that children should never know about at that young age.
Right.
So it was pretty scary, and he was very angry when he came into the inpatient facility.
Wow.
At a really young age. So.
Two more
Yeah.
questions. So have you ever worked with the mental health issues with youth in CPS custody? And what was your viewpoint on that matter?
So I've had some issues with their department because they've been under a lot of controversy, actually here in our county, because of the way that they respond to calls. And I have had some situations where I've known that the person that went out to interview the child, so let's say I call in an abuse report, and the person that went out to interview the child was just so inappropriate with how they were treating the child, which it's already scary when someone's coming out to your home saying what's going on. And the way that some, obviously not all, but some of the caseworkers were talking to the children, either just blatantly ignoring them or saying things inappropriate or just being very insensitive to a very traumatic situation. I've had issues with that for sure.
Oh, wow.
So we're working on changing it, but yeah, it's been a little tough. So.
Wow, I want to thank you for taking the time to interview with us. I really do appreciate it. Before we go, give everybody your contact information and where they can find you. And if you want, kind of expound on anything you're working on in the future, if you'd like to.
Sure. So my contact information, I am on Twitter. It's Dr.Hammond. And also on Facebook, Dr. Nikisha Hammond. And currently, as I mentioned before, the Practical Guide to Raising Emotionally Healthy Children, it actually just came out in the paperback form, and there's also an ebook on Amazon.
Awesome. Thank you so much for your time. I really appreciate it.
No problem. Thanks so much for having me.